Thinking about vitamin B12 injections at home, whether you've just been diagnosed with a deficiency or you're exploring your options, this video covers what you need to know and what to discuss with your GP. One important thing up front, this video is general information only. It does not teach injection technique or dosing. If home B12 injections are right for you, all training, prescribing and scheduling must come from your GP or practice nurse, not from a video. So, what exactly is a B12 injection? It's a dose of hydroxycobalamin, the standard UK formulation, delivered either into the muscle or just under the skin. B12 is essential for red blood cell formation, neurological function, and DNA synthesis. Your body can't produce it on its own, so if you're not absorbing it properly through food or oral supplements, injections are often the most effective route. Who typically needs them? People with pernicious anemia, an autoimmune condition where the stomach can't produce intrinsic factor, a protein needed to absorb B12. Also, people with malabsorption conditions like Crohn's disease or celiac disease, those who've had gastric surgery, and people on certain medications like metformin or proton pump inhibitors, which can interfere with B12 absorption. Strict vegans or vegetarians with a confirmed deficiency may also be candidates. The key word there is confirmed. Your deficiency should be diagnosed through blood tests before any treatment begins. It's also worth knowing that folic acid should not be given on its own before B12 deficiency has been properly assessed, as it can mask anemia while allowing neurological damage to continue. Now, can you actually do this at home? For some people, yes. Home administration is NHS supported for confirmed deficiency, but it's not something you can simply start on your own. You'll need a GP prescription, and you must only use licensed products dispensed by a UK registered pharmacy. Please don't source injectable B12 without medical supervision. Once your GP confirms that home administration is appropriate for you, you'll receive face-to-face training from a practice nurse. They'll show you the correct technique, the right injection site for your situation, and make sure you're confident before you administer anything yourself. The route, whether intramuscular or subcutaneous, and the injection site are determined by your prescriber and the nurse who trains you. Your dosing schedule and frequency will also be set by your clinician based on your individual needs and symptoms. One thing that often gets overlooked is sharps disposal. Used needles must go into an approved sharps container and never into general household waste. You can return full containers through your GP practice, a participating pharmacy, or your local authority's collection scheme. Now let's talk about side effects. Minor reactions at the injection site, like redness, mild swelling or discomfort, are fairly common and usually settle within a few days. Serious side effects are rare, but it's important to know the signs of anaphylaxis, a severe allergic reaction. These can include sudden swelling of the face or throat, difficulty breathing, a rapid heartbeat, or feeling faint. If any of these occur, call 999 immediately. For anything that concerns you but isn't an emergency, contact your GP or call NHS 111 for guidance. So, what should you be discussing with your healthcare provider? Ask whether home self-administration is appropriate for your situation. Make sure you receive proper face-to-face training before you start. Ask about your dosing schedule and what your maintenance plan looks like, and find out about sharps disposal arrangements in your area. To recap, B12 injections at home are NHS supported for people with confirmed deficiency, but they require a GP prescription, a licensed UK pharmacy, and proper training before you begin. Your clinician determines your dose, your schedule, and your injection technique, not a video. Anaphylaxis is a medical emergency. Call 999 and always dispose of sharps safely. This video is for general information only. Please speak to your GP or healthcare professional for advice that's right for your specific situation. If you found this helpful, leave a comment below. We'd love to hear your questions. And for more straightforward health information like this, give us a like and subscribe to the Bolt Pharmacy channel.